Hey guys, welcome to the Introduction to Healthcare Systems slideshow presentation. This is a rather long presentation. I'm going to try to do it all in one recording, but keep it as simple as possible for you guys. Anyways, I hope you enjoy these recordings, and I hope that they're helping you guys study. So, without further ado, let's get on into the slideshow. On slide one, we're going to talk about a discussion in which areas most successful healthcare students have knowledge and skills. I think this encompasses everything: oral and written communications, employability skills and teamwork, legal and ethical responsibilities, safety practices, what teamwork means, especially in a healthcare setting, and then health maintenance practices. All these are units that we're going to cover. Obviously, we've already covered oral and written communications, and legal and ethical responsibilities are coming up after your career unit, and employability skills and teamwork is a huge portion of the last unit we covered before break. But all of them are essential to your success as a healthcare provider. And then information technology, understanding how to use a computer. Health science careers, growth in health career occupations has soared in the last decade. They say that there's a clear understanding of the expectations of health science students is an essential piece to that. Health career programs are competitive and demanding. A brief history of the healthcare industry. This you go more into this when you're reading the book, and essentially when you are going over all the different decades and history of what people are doing and who's doing it and things like that. It's important that you pay attention to that stuff. But primitive people were superstitious and believed illnesses were caused by invasion of spirits, like possession. Think about the poltergeist or things like that, kind of supernatural forces controlling them. Ancient medicinal tools of the trade that were used, body and face paints were thought to help to scare away evil spirits. Wood splints for injuries, casts for hardened hide or for fractures. What that means is wood splints were used to brace for after a broken bone. Casts were made from hardened hides. Bone needles were used to sew lacerations. They would sharpen bones to use as needles because they didn't have needles. And if you think back, how surgical or how sanitary were these practices that they were utilizing, and you wonder why the average life expectancy back then was 35, 40 years old, even younger in some cases. If they got hit by one animal attack or broke one bone, the odds of them for surviving were very slim. And those are some depictions of what those needles look like, and you see that they're um, pretty blunt, on the tips. They weren't very sharp, and so pushing that through the skin, you can imagine, didn't feel very good. Chinese, they were kind of where it all started after that. Evil spirits and tribal practices, and these doctors really honed in on the practice of acupuncture, which is little itty bitty tiny needles they poke into muscles to relieve tension. And they were also the first to study the pulse. If you find the pulse by reaching down your neck here, you go to the ear, down the bone, right down there is your carotid. If you can't see on the screen, another place is on the radial pulse. It's right here on the thumb side of your wrist. You can feel your pulse there. But they were the first ones to study the means of pulse for a diagnosis, saying, hey, when the pulse is fast, something's going on, the heart's beating faster. Maybe it's trying to fight off an infection or some sort of issue is going on. And when it's slower, maybe that means that it's sick and it's slowing down to divert the blood somewhere else so that it can deal with that issue that's there. So just know that. Egyptians, they believed in they were the first to begin medical examinations. They came up with what a diagnosis and a prognosis is important that you remember the difference between diagnosis, which is the cause of the disease, and then prognosis, forecasting the probability of what the outcome of this disease would be. And the example of that would be you are diagnosed with cancer. The prognosis is that you are going to receive chemo, radiation therapy over the next 6 months, and we'll reassess at that time. So Another extreme example of that would be you're diagnosed with cancer. Your prognosis is death in the next 4 to 6 weeks. So that's an extreme example. First to record accurate written health records used via hieroglyphics. They're all over the tombs and pyramids in Egypt. But that was the first mean that we found of actually written down um, health records. Now the Greeks, they were onto something here. They really thought that diseases were caused by poor sanitation, and they built aqueducts. And what that means is they diverted the water. So think about your house and how every time you flush the toilet, where's that water go? Or every time something goes down the sink, or the dishwasher runs, or the wash machine runs, where's that water flow off to? Before, they were using buckets, troughs, community water holes, and these created a cesspool for bacteria to grow and ultimately causing illnesses. So what the Greeks did was they thought, what if we diverted all this wastewater to one location and everybody stayed away from that location? Aha, they were onto something, weren't they? Genius. So they created a lot of the same ideas that we use today. Of course, we've gotten that technology better and better as years have gone by, but they were the ones that started all that. Also, one of the most famous Greeks and the doctor or the father of medicine, um, Hippocrates, or also known as Hippocrates. He is the father of medicine. He didn't dissect people, but he observed them, and he was the first one to look at somebody in all over their body and kind of start mapping it out. He took careful notes of signs and symptoms of diseases when somebody was coming down with something. He was the one that documented everything that was going on. Disease was not caused by supernatural forces. So what they said back then, and with evil spirits, and what the Indians said, Native Americans thought, he's the one that said, no. If they're sick, there's a reason why they're sick. Father of medicine is what we call him, and he wrote the standards and ethics that are the basis for today's Hippocratic Oath. And the Hippocratic Oath is what you take when you are becoming a doctor, or when you do become a doctor, excuse me. When you do become a doctor, you take the Hippocratic Oath, and that's what tells you to basically take care of anybody and everybody, no matter what. And that's what you're taking the oath as a doctor. Another Greek doctor was Galen, and he was one of the greatest surgeons of the ancient world, performed brain and eye surgeries. The caduceus, which is that cool little serpent and staff and wings, angel wings, the staff, and then the two serpents around it. That is the symbol of medicine, and is still used today in modern symbol, and it symbolizes peace. If during war times or any times of distress, that's where we look for peace, is the medical corps. An emblem of medicine in the United States still today. Asclepius, which resembles the caduceus, but both the caduceus and the staff of Asclepius are used to represent the medical profession. So sometimes you see that most commonly, you see it on the sides of ambulances. Hospitals are an invention of modern times. That was a myth. The first hospitals were created in ancient Roman times, and they were organized. They were the first to organize medical care, and also invented many surgical instruments that we still use today. They were the first to organize medical care. Some of the pictures here are the scapula. The scalpels. Scapula, that's your shoulder. Bloopers, no outtakes. This is one take, give all. So it is what it is. Tweezers, things like that, or what they call forceps on the top, and then a scalpel and surgical needles. They also were the ones to first establish hospitals or buildings that were only for sick, and to keep those people secluded from others. And Roman physicians wore the death mask, and you can see the death mask there on the slide. And that is a spice-filled beak, which Romans believed protected them from infection or bad odors. And of course, if you're thinking back then, where there was not very many hygienic standards or practices, there was probably some pretty stinky patients. Native Americans, now back to them. The earliest practitioners of medical arts, traditions were passed from orally from healer to healer. The Navajo and Cherokee tribes used herbs and natural pain relievers that are still common today. Some of those things that you can think of are located in the book on box 1-1. Fresca. Delicious. 0 calories. So get yourself some Fresca. The bark of a willow tree used as aspirin to reduce inflammation. Citronella, which is still used today to repel bugs. Eucalyptus, foxglove, green tea, lavender oil, lemon oil, all things that we still use today, especially with this new essential oils or young living oils kick that everybody's on. Some of your parents maybe were on some of those. Well, they got that from the Native Americans. During the Dark Ages and Middle Ages, when Roman Empire was conquered, the study of medical science stopped. Medicine practiced only in convents and monasteries. Life and death was in God's hands, they believed, and little interest in curing diseases by man hands. But true doctors did not exist at that time. Hence the reason why things like the Black Plague, diphtheria, all those things ran rampant, because there was nobody really putting forth any standards or quality of medical care at that time. Some of the epidemics that I just mentioned, like the bubonic plague, smallpox, diphtheria, syphilis, measles, typhoid fever, and tuberculosis were really rampant at that time. During the Dark and Middle Ages, the Islamic civilization is the ones that rose to prominence in the medical science during the Middle Ages. Arab doctors contributed to anatomy and ophthalmology, pharmacology, physiology, and surgery, and they also established what we know now as modern hospitals. So go ahead and give props to the Islamic civilizations for going and deciding finally that we needed some sort of organization in the medical community. Some of these things are like anatomy, which is the study of the body, ophthalmology, pharmacology, study of drugs, physiology, the study of how the body works, and surgery, of course, fixing things via surgical means. Maimonides, a doctor in the Middle Ages, emphasized the importance of healthy lifestyle. The Jewish philosopher described asthma, diabetes, hepatitis, and pneumonia. Basically, they started realizing now that if you ate right, if you exercised properly, if you took care of your body with hygienic practices, you probably live longer. In the Middle Ages, a barber did more than just cut hair, which is pretty unique. What other services did they perform? Surgery. If you had a toothache, go to the barber. If you had some sort of pain, he maybe would practice bloodletting on you, which is when basically they drain the blood out of a certain area because they thought that would help relieve the pain. They traveled with armies. Not only could they cut hair, but they could cut you open too. The barber surgeon usually would have the red, which meant blood, white, which meant bandages, and blue, which meant veins on the outside. And it's still what's used today at modern barber shops. You see the same thing outside. That kind of became normal practice. During the Renaissance, a printing press made it possible to mass produce medical books, and scientists began to use scientific method. The microscope was invented and improved by Anton von Leeuwenhoek. Anton von Leeuwenhoek invented the microscope. That's probably important for you to know. When scientists began using the scientific method, it kind of made a common theme throughout medicine that they would all use the same practices, and that helped them in the long run. Now, during the Industrial Revolution, factories allowed mass production of medical equipment, so that means it became easier to access. The stethoscope and practice of vaccination were invented. Public health laws designed to control the spread of disease were established. That means things like washing your hands, make sure like things like the city now goes and inspects restaurants and homes and things like that to make sure they're within compliance. Those kind of things started to be invented during the Industrial Revolution. Edward Jenner, he was an English doctor in 1796. He developed a vaccine for smallpox, and pain management became more prevalent at this time. Why was the invention of anesthesia in the 19th century so important to medical practice? Well, think back to what I was saying about The blunt needles, um, the um, barbershop. If you went to a barbershop, there wasn't anesthesia there. It wasn't like the barber was like, "Here you go, let me hit you with some anesthetic. We'll numb you up and we'll pull that tooth or we'll drain your blood." It was like you show up, they say bite down on this towel, take a couple drinks of some sort of alcohol, and hopefully you survive this procedure. That's really what it was like then. So when anesthesia became possible, it basically learned it would numb all the nerve endings in that location that they were doing surgery, and so it would prevent you from going into shock. With the invention of anesthesia, fewer patients died from shock and pain. Some cool things about women in medicine. Florence Nightingale, she tended to the wounded soldiers in the Crimean War and was founded the first secular nursing school at the St. Thomas Hospital in London. That's why nurses nowadays, just like doctors take the Hippocratic Oath, nurses take the Nightingale Oath because she was considered the first, like the founding mother of nursing. Elizabeth Blackwell, first woman to formally study the practice of medicine in the United States, and Clara Barton formed the American Red Cross, one of the largest humanitarian organizations that we still have today. Pathogens and sterilization. Ignaz Semmelweis and Joseph Lister promoted the benefits of hand washing. Louis Pasteur, he helped develop the study of infectious microscopic organisms. To better understand what Louis Pasteur did, if you ever look at your milk carton at home, it says pasteurized. Well, guess what? Louis Pasteur created the pasteurization process that will kill the microscopic organisms that could live in milk or things like that makes it have a longer shelf life. Robert Koch discovered that some diseases are caused by pathogens. The 20th century and beyond. Dun, dun, dun. Penicillin became the first antibiotic used to treat bacterial infections, and that was Alexander Fleming. Fleming. The development of X-ray technology opened up new possibilities in healthcare. That was Wilhelm Röntgen. He invented the X-ray. 20th century and beyond, other important developments include the CT scan, electrocardiogram, which was Wilhelm Enthoven also invented those. CT scan looks at your brain, and the electrocardiogram can follow the beats of your heart and the electricity current that your heart produces. Radium and insulin. Marie and Pierre Curie discovered radium and therapeutic uses for radiation, including cancer treatment. Insulin discovered by Frederick Banting and Charles Best, which was insulin is a substance that is produced in the pancreas. If you are a diabetic, type 1, you have no insulin production at all. Type 2, you have not enough insulin producing, meaning that your body is requiring too much and you can't produce or keep up with it. Methods of harvesting and later reproducing insulin were developed at that time. DNA. In 1962, James Watson, Francis Crick from those date ranges, and Maurice Wilkins were awarded the Nobel Prize in Physiology and Medicine for their discovery of DNA. And what they realized was that everybody has unique DNA. The discovery of deoxyribonucleic acid, which is also known as DNA, and this stuff is a review for you from biology. The molecule that carries genetic information took place in April of 1953. How has this discovery affected medical science? Well, studying DNA involves the identification of genes that trigger major diseases, influences the creation of drugs that treat these diseases, and the identification and analysis of the genes has greatly influenced therapeutic treatments. Basically, what all that mumbo jumbo saying is, because they can study DNA, they better understand how human bodies work, and that things like things that are DNA markers can result in understanding why things happen. And maybe it's hereditary, maybe you can be predisposed to it, things like that. So it's really taken medicine a long ways. Some of the modern medical machines and electronics that we use. Dialysis machine. If you have kidney failure, your dialysis machine can filter your blood for you. That's what your kidneys do, is filter your blood. And your liver also has a filter, but a dialysis machine can do that for you. So if you have kidney failure or anything like that, then dialysis can prolong your life. Organ transplant continues to be increasingly successful, and more. They've actually transplanted hearts, eyeballs, livers, kidneys, pretty much every major organ now. Robotic devices are used to assist in microsurgeries and hospital pharmacies. If you've had a modern surgery, you know that there's orthoscopic surgeries where they can go in with little holes and simply fix whatever it is via camera. Kind of like playing one of those claw video games. The healing for this is a lot faster, it's a lot less invasive, therefore the recovery is shorter as well. Treating mental illnesses, psychoanalysis is a method of treating mental illness and emotional disorders, not just medication, but psychiatric medication is gradually becoming more prevalent during the 20th century, and public and private psychiatric hospitals serve the mentally ill. What is post-traumatic stress disorder, and what group of people often suffer from it? So I don't want you to get confused here with post-traumatic stress disorder only being related to the military, but it's anybody that's ever suffered any sort of traumatic experience. That could be a car accident, sexual assault, um, school shooting victims, anybody, not just military personnel, but oftentimes it's related to military personnel. Term various psychiatric conditions formerly known as shell shock, many soldiers who serve in war experiences, but I don't like that general terms. Genomic medicine or genomic medicine is studies a person's DNA sequences for differences. These differences may explain why one person will develop a disease, respond to a certain drug, and another will not. Researchers may be able to determine genes that cause certain diseases. Like I was saying before, that's basically the study of DNA has allowed us to understand more deeply what causes certain things. So part 2 of this really focuses on what healthcare is today in the United States as well, as far as government health insurance programs and laws. Government health insurance programs and laws, private managed care plans, and government agencies that provide healthcare services, as well as volunteer agencies. The big thing to understand here with the difference between Medicaid and Medicare is that last suffix, care and CAID. Really focus on the care and aid portion. Medicare is a government-funded insurance program that covers people over the age of 65 who are eligible. It also covers those who have disabilities, though. So remember, it's not just old, but it's disabled as well. So those that need care get Medicare, medical care. Medicaid is an insurance program for people who have low incomes or need aid. They need assistance. They can't afford good medical care, so these are paid for by the state and federal taxes, and they're called Medicaid because they provide aid. So think about aiding somebody financially is what Medicaid is, paid for by state and federal taxes. Military healthcare system is TRICARE, and it offers medical coverage to everyone in the military, active duty retirees and their families. Sorry, my son was peeking down the stairs. Workers' compensation, or workman's comp, is a form of government insurance, provides wage replacement, medical benefits for employees injured while at work. Most states require employers to have workers' compensation insurance. That covers if you get injured on the job. So, say I'm a teacher, and while I'm up here working, I slip and fall, and I could say I got hurt doing my job, and I could get workman's comp. Or as a wrestling coach, if I am showing a move and tear my knee, then that could be cause for workman's compensation, with the insurance will cover that. The Affordable Care Act was passed in 2010 with the intention of increasing the quality and affordability of health insurance. What are some ways that the law accomplishes these goals? And if you're thinking Affordable Care Act, what's that? 2010, I should know what that is. Well, Affordable Care Act in 2010 is also known as Obamacare, more commonly known as. The law requires insurance companies to cover all applicants within the new standards. That means even if you have a pre-existing condition, such as diabetes or COPD or CHF, which COPD is chronic obstructive pulmonary disorder, or CHF, which is congestive heart failure, diabetes, we've already talked about. If you have any of these issues, kidney disease, you still have to be covered by insurance within a reasonable amount. Before AHCA was adapted, these companies could deny you the ability to be covered. What that did was it made them lower the insurance rates because they weren't covering these. Now insurance rates have gone up because they're required to cover them. People are to be offered the same rates regardless of pre-existing conditions, but same rates means, okay, even though you're healthy, we've got to charge you more because these pre-existing conditions exist and others to offset the balance. Nothing's ever free in our country, at least. But there are some socialistic healthcare systems like Canada that provide completely free healthcare, but there are some downfalls to that too, as far as wait lines, access to what drugs, genetic versus actual name brand things. So keep that in mind. And also, ACA allows dependents to be covered by their parents on insurance policies until age 26. Why is that important? Because if you go to college, do you have the money to pay for your own healthcare plan? No. So what they say is they give you to the age of 26 to kind of get your life together, get your future planned out, and have your own health insurance plan. Private versus managed care insurance plans. Insurers have developed managed cares to try to control healthcare costs. So HMOs provide prepaid comprehensive healthcare at a flat rate for a fixed period of time through network. So what that means is if you have an HMO, then you have comprehensive healthcare coverage at a flat rate. So $100 a month for 1 year through a network of providers. If you have a PPO, which is a contract with a network of preferred providers from which one patient can choose, it's a little more expensive because the cost could go up, but you can choose which provider you go to. You don't have to stick to the network of providers that are provided in the HMO. How are we controlling healthcare costs? Healthcare costs have risen for a variety of reasons. Americans are living longer, poor diet exists, lack of exercise in the country, and more people are being diagnosed as diabetics. As healthcare costs rise, so do the healthcare insurance premiums. Just like I said before with ACA, because everybody has to be covered now, then the rates go up because they have to account for those that are not healthy. Many cost reducing efforts have already been implemented, like limits being placed on the amount of hospital can charge, provide preventative care at no cost, like a flu shot. Most insurance provide the flu shot every year for free. Healthcare reform calls for major changes that provide affordable insurance for everybody. What are some government agencies for health services that are aiding in this? United States Public Health Service, those are the ones that are in charge of making sure that restaurants follow rules, grocery stores follow rules to make sure that things are going on right. Sewer systems are working. Things are clean, generally clean. The rain drain-off systems are working. Occupational health and safety, make sure that the workplaces are safe. CDC, that's in Atlanta. If you ever watch Walking Dead, that big part of Walking Dead season 1 is the CDC, but they're the ones that are in charge of managing all disease control in America. So in prevention, so the Ebola crisis, H1N1, all those things went through the CDC. And they're always constantly monitoring the situation around the world to make sure that we're one step ahead of what's coming. Food and Drug Administration, that's what regulates all the food and drugs, which is medication over the counter medications in America. Some of the things that aren't managed are things like vapes, vitamin supplements, weight loss supplements, anything you get at like a supplement store, GNC, things like that. Those aren't managed, those aren't regulated by the FDA. National Institutes of Health, the NIH, and the World Health Organization, they all work together to regulate healthcare as a whole in common practices. Some volunteer agencies play a huge role in advancing good health in communities. Some of those we already talked about. One of those is the Red Cross, but the American Cancer Society develops research, generates funds for researching muscular dystrophy or MDA, National Association of Mental Health, and American Red Cross. They all provide funding basically for these things outside of the government's control. So they provide additional funding outside of what the government can give to them, and basically they aid in learning more about them, like the Ice Bucket Challenge, things like that helped raise money for different things. So healthcare facilities, the United States has more than 6,500 hospitals. Hospitals may be nonprofit, for-profit, or government-owned. They are short-stay hospitals that offer treatment for acute care or severe medical problems. And then there's long-term care facilities that have increased in recent years because um, they've increased in recent years because um, the average age is going up. So specialty centers that exist like trauma centers, surgical centers, urgent care centers, walk-in clinics, optical centers, mental health facilities, kidney dialysis centers, rehabilitation centers, they all exist to specifically treat one thing or another. Urgent care is like something quick. You break your arm, you can go to urgent care. You have a cough, you can go to urgent care, not go to the hospital. Walk-in clinics as well, like what you see in CVS or Walmart pharmacies. They all can help you. Optical centers, those are obviously for your eyes, and mental health facilities, kidney dialysis centers, they all specialize in helping um, in just what they say, mental health, kidney dialysis, of course. They took those out of the hospitals so that they didn't have to get overwhelmed by the amount of people that need dialysis or that are suffering from kidney failure. And then rehab centers, of course, if you have any type of knee injury, physical therapy needed, or maybe you had a stroke, those are rehabilitation centers can aid in the rehabilitation, which also took the load off of hospitals. Doctors and dentist offices is your common run-of-the-mill family medicine practice, as well as dental offices that you go to. Many of you have probably been to the dentist. Hopefully, you've been to the dentist, and hopefully, you've been to the doctor before. Some of these doctors focus on specialties such as orthopedics or cardiology, and some dentists even have in recent years learned to specialize by treating different age groups, pediatric dentistry or orthodontics or oral surgery. Facilities that offer care for terminally ill or dying patients are called hospice facilities, and that doesn't always mean that they are dying. It just means that there's nothing that can treat them further. Uh, just relieving their pain. Pain management becomes the center, not rehabilitating. That's also referred to as palliative care. Something you should know. Write it down. Consumer responsibilities. Really, what that comes down to is understanding how the healthcare system works, which a lot of people in this country don't understand. And so, understanding how it works is huge, as well as self advocacy, eating healthy, getting your exercise, um, taking care of yourself so that you don't have to continuously get care will help everybody in the country keep insurance rates down. It is the patient's responsibility to seek medical care, follow doctor's orders, and take advantage of available resources. Regulations for healthcare workers. Rules and guidelines vary depending on where you're working and what facility you're working on, but know that there is a set standard that you must follow as far as it pertains to regulations and guidelines. Some general rules are treating patients with disabilities, patient rights, eligibility for medical care or Medicaid, reporting facility accidents, reporting communicable diseases, and maintaining confidentiality. Um, when you start working at a facility, they go over all these things in depth, as well as if you become a doctor or a nurse or anything in the healthcare field, you learn all about HIPAA and about what you can and can't say, how to treat certain patients, what the patient's rights are, how your facility that you're going to work at, how they um, address these issues. And so just kind of look forward to that as you progress your medical career and you get your first, even if you go into clinicals or any sort of practicum course or EMT, pharmacy, and you get practical experience in a facility, you'll learn about these kind of things more in depth. Now, what are we looking at in the future of healthcare? You know, The sky's the limit. If you ask somebody 20 years ago, would they say that we had a transplant? I don't know. Would they say that we would cure all the cancers or cure every, hereditary or chronic diseases out there? Maybe. But really, what the future of healthcare looks like for us is controlling healthcare costs, more research to find cures and treatments for these diseases, and then also healthcare workers continuing to provide outstanding care to those who are ill. Without healthcare workers, it's nothing will be done. Quality healthcare workers really provide a clear, definitive means for these people to get better. And when you're sick or ill or injured, think about what you feel like when somebody brings you a bowl of soup, whether it's your mom, your dad, your friends, or brings you a get well soon card, things like that. Those things go a long way. So healthcare workers need to continue to provide that care. Something I want you to think about. What area of healthcare do you find interesting as a possible career choice and why? I know we've talked about this in class a little bit and you guys are still formulating that, but our next unit coming up in the middle of September is the career unit. And you're really going to get the chance to research and focus on exactly which career you want to pursue. So think about that, be thinking about that, and have a good idea and understanding of what that means to you. Hey, we made it through Unit 2, video recorded lecture. Hopefully, it wasn't too bad, terrible. I know it was a lot of information. Feel free to slow this down, speed it up, laugh if you can, but um, it's important for you to understand that this is important information, especially understanding the healthcare systems and how it works. And there was a lot that we covered in this unit. So make sure that you are going back, looking over the slides, looking over your notes, talking to those people, um, talking to those people that are um, around you that are in the healthcare field and kind of get an idea of what it means. Go home, talk to your parents about insurance, understand what insurance plan you have and how that insurance plan affects you. Ask your parents about a PPO and an HMO. Surprise them a little bit that you're interested in how that all works. Those conversations will go a long way with your understanding of it because so many different health insurance plans are so different. So without further ado, I want to say thank you for listening. Thank you for paying attention, and hopefully this is helping you. Until next time, deuces.